So everything revolves around the thalassemia. As we've got older, we've just become more dependent on the NHS. I don't know any different. People say, how do you cope with it? And I don't know any different. I was born with it. And ever since I can remember, I've been having blood transfusions. Facilities have changed, over time. Everything has improved. Our level of care, our environment that we go into, we're in a nice new unit, and we're treated really well. The nurses look after us, spoil us as well. They do go out their way, and they do above and beyond. So I'm grateful to all the NHS staff that look after me.
I would say my experience living with sickle cell is pretty unpredictable sometimes, because you never know when pain might come, because nobody really wants to be in pain. I think with a good healthcare experience, I think when it comes to sickle cell, I think most people would say it just is how swift they respond, how delayed the response is or how swift they respond. If they act fast, that's really, really good. And if they listen to you and try to understand what pain they're going through, because nobody's really gonna really understand, because they don't have that pain. Some A&Es I've been to where they don't know what sickle cell is. Yeah, I've been to an A&E where they didn't know anything about it. Yeah, so it was really, really challenging. And I was in pain, and I think their policy is they don't give really high pain relief, which is the policy they have in place. So it's not like they're not trying to help you, it's just they tell you, this is the policy we have. In the A&E, we don't give this. Unless you go to the ward, that's when they can give it to you. And then you kind of have to explain to them, this is what I'm going through. Sometimes I open up Safari and I'm like, this is what it is. And they're like, okay, we have an idea. We've heard of cases like this before. Yeah, that's just some A&Es. And then you kind of have to wait, the pain relief is delayed, and you start getting stressed out because you're in more pain. But yeah, sometimes it's difficult, it's challenging for some A&Es, but it's because they don't have a clue what it is.
I always say there's like 3 weeks I have. Every 3 weeks I have my transfusion, so I get a good week and a half where I can do whatever I want and whatever I need to. So the important stuff gets done first, and then I'm just lagging towards the end of the 3rd week. So I slow down a fair bit then. I've been done for the day, and then home for a nap. That's my day done. It takes a lot out of you. And before when we were kids and that, you'd have the blood and you'd be bouncing up and down like you're a kid on sugar, and that doesn't happen anymore. Like, I need my bed.
Everyone is different. I think you just kind of have to understand how their pain works and then create a care plan for them. So that when I go to the day case to get my blood exchanges, my experience there is really good, because they kind of offer any support that you're looking for. As soon as you come in, they ask if you need water, if you want to stay warm, because especially during winter, if you've got sickle cell, it's good to avoid those type of temperatures, and it's good to avoid stress. So they kind of ask you all these questions before they get straight into it. They just want to make you comfortable, which I think is really important, because sometimes you come in, because it's every 6 weeks, so you don't really get used to it. Because when you come in, you're nervous. You're like, we're going to do a blood exchange again. But then I think they make the experience really, really smooth. They try to keep you calm, and they try to make you comfortable.
It is hereditary, and if you are a carrier, you could pass it on to your children. And so for their future and people, I guess, awareness for the future generations, people should be tested. So we take it for granted, that the blood is always there. But if it wasn't for the generosity of these donors already, I wouldn't be here today.
It's really good to get tested, because the sickle cell trait is something you need to know you have. So how it works is someone that has sickle cell will have sickle cell fully. And if you have a sickle cell trait, you probably just have one gene of sickle cell. But it's good to know that, because when you look at long term and you want to get married, or you want to get a partner or have a child, if they have a sickle cell trait as well, so both of you might not have sickle cell, and you've probably never experienced the symptoms, because it's just a trait. Some people have the trait, they don't experience any symptoms in their lifetime. But if they have a trait and you have a trait, chances are one of your child will have sickle cell. So it's really, really good to know that, just to avoid that. So it's good to go to NHS, get a free blood test. Go to your GP, just ask them, I want to do an NHS blood test to check if I have sickle cell trait.
I have the luxury of the blood being brought to me. It's given to me on a plate, literally, and I think if I was anywhere else, I don't think I'd be around today. If it wasn't for the NHS and the donors that give the blood, yeah, I wouldn't be here.